Well, hello everybody, and welcome to Managing Chronic Pain, a holistic approach with Dr. Olivia Ong, brought to you by Drop Bio. Dr. Ong is a physician leadership consultant, medical business coach, speaker, author, and pain physician with a thriving pain management medical practice in Melbourne. Olivia has also learned what it was like to be a patient on the other side of the healthcare system, dealing with chronic pain after a devastating accident which left her seriously injured. Despite this, she managed to advance her career as a dual trained rehabilitation medicine and specialist pain medicine physician, and even started a family. Her story is beyond inspiring, and we're really grateful to have her here sharing with us tonight. Welcome, Dr. Olivia. To start, I thought, could you tell us a little bit about yourself and how you got to where you are today?
Yeah. Thanks, Abby, for that kind introduction. So, hi, everyone. My name is Dr. Olivia Ong, and I've got a backstory to tell. And the reason why I became pain physician all started way back in September 2008. I was a junior doctor at that time. I just literally started my rehabilitation medicine registrar program to train to be a rehab medicine physician. So I was walking along hospital car park on my way to work, just like a normal ordinary day, and I was hit by a car at high speed. That impact rendered me a paraplegic. I was paralyzed from the waist down. Not only I was not able to feel my legs, I wasn't able to move them either. Eventually, I was diagnosed with a spinal cord injury, a very serious spinal cord injury, in fact. And I was told that I will never walk again. And I remember that I was only 28 years old when that diagnosis was given to me, and I felt really devastated. I literally was just starting my life. I was just married to my husband at that time for 2 years. We were, we have a really beautiful life, and we still do. At that time, we've got lots of friends, and then in an instant, I became a patient on the other side of the healthcare system, and I was in hospital for a total of 6 months, and eventually I was discharged from hospital. And I had to adjust to living life in a wheelchair. And I literally watched all my friends move on with their lives while I stayed paralyzed and stuck literally in a wheelchair.
It's just devastating. A
Mm,
huge, huge
mm,
change of
mm.
trajectory.
Indeed,
Mm.
Abby. And I was in a wheelchair for a couple of years. And one day in 2010, I heard about a spinal cord injury recovery center called Project Walk. This particular center is based in San Diego, United States. It offers intensive rehab to help spinal cord injured survivors learn to walk again. And I told myself I have to do everything and anything in my power to achieve my goal to learn to walk again. Because all those years, me being paralyzed in the wheelchair, just watching everyone's life move on, I it never destroyed my desire, I guess, to learn to walk again. And when I heard about Project Walk, I jumped on the chance and told work I'm going to take a couple of years off. I knew that I'll be there for a couple of years. My hubby John did the same, and we relocated to San Diego where I could attend intensive rehab for a total of 3 years, actually. Yeah.
Huge. Wow.
Mm, yeah. And in that experience, it was I thought that learning to walk again and the state of the art technology was what was going to heal me, but I realized that experience, that journey to learn to walk again, Project Walk, taught me a really powerful life lesson: self-compassion. And that's why I'll be teaching our audience today a bit about how you can implement self-compassion mindfulness in your, I guess, in your chronic pain experience, and how you can still lead fulfilling lives and not give up hope. And that's
Yeah.
what happened to me. I learned about self-compassion through my journey to learn to walk again. Because before the injury, I was just, on autopilot all the time. And I'm sure many of you can relate to just, doing your checklist. And sometimes you might be driving and then you reach a destination and you go, how did I even get here? I don't like that's autopilot. And then you'll be, when you're working, you're just like busy, busy, busy working. And then before you know it, it's already 5 o'clock. And you're like, what have I been doing all day? I just like, just
Yeah.
been, yeah, yeah. And that was my life before my injury. And that journey to learn to walk again actually taught me how to appreciate, how to adopt mindfulness. Because to think about it, I had to learn to crawl again, stand up again, and walk again, just like a baby would. And children and babies are the best mindfulness teachers.
Yeah.
And you probably can relate to that. Those who have kids and nieces and nephews, kids are they're curious. They have an open, they have what we call beginner's mind. They love learning new things, and they're just curious about the things around them, and very, very mindful in what they do. And my journey to walk again, I learned all that, and yeah, and
I was just going to say it's an incredible story, really an incredible story. I mean, here
yeah,
you are today, you've gone on to have a family,
exactly, yeah,
you're working, you're walking. It's just amazing, and we're very grateful to have your experience and wisdom around how we can manage pain and look at that
yeah,
holistic component as well, which is so important.
yeah.
But also to have your own personal experience for you to generously share that with us as well. So thank you so much, Dr. Olivia.
Thank you.
We can't
Yeah.
wait to hear more from you. Very shortly we will. I just wanted to, before we got too far into the event, just go through a little bit of housekeeping before we kick off. So I can already see a few questions and comments coming through in chat, which we absolutely love. We've got a few questions our community, the drop-in, have put forward earlier this week also for Olivia to answer later on. But if you have any questions that come up for you throughout the event at any time, you can submit them in the chat box on the side of the screen, and then I'll read them out for Olivia to answer at the end of her presentation. You can choose as well whether or not you submit those anonymously. Before we do get stuck into today's presentation, I did want to briefly share some context about the company behind this event, Drop Bio. So just bear with me while I pull some slides up. So who is Drop Bio and what do we do? Well, Drop's mission is to accelerate the world's transition to personalized health. We're driven to provide meaningful insights into your health so you can be empowered to take charge of your well-being. How? We do this via a product that uses finger prick blood taken at home, combined with lifestyle indicators to show changes in your health over time. More on that in just a moment. Our aim is to bring you up-to-date, meaningful information about the health topics that matter to you, brought to you by our team of expert medical and holistic health specialists. This is shared and discussed in communities like the Drop-In Women's Health Facebook community, along with our digital courses and events like this evening's. There's even the opportunity to get involved with product testing and development via the Wonder League, which is Drop Bio's community product testing team. We've hosted loads of events on topics ranging from postnatal depletion to nutrition, mindfulness, menopause, career, financial wellness, and we look forward to bringing you many more exciting and free live events this year and next. Visit our events page on dropbio.com to register for upcoming events. Our first wellness product launched earlier this year. It's called Wellbeing by Drop, and it's designed to help you take back control of your health. Using simple at-home finger prick blood collection, we're able to provide you with practical and actionable recommendations to support your health journey. And the next release is due early next year. To get your name on the wait list, head on over to dropbio.com or via the link that we're putting in the chat box. I did mention as well the Drop-In Women's Health community, where you can access regular events like this evening's, along with Q&A sessions with expert health specialists. Most importantly, we created the Drop-In as a place where like-minded women can connect and support each other on their individual health journeys. So come hang out with us after tonight's event. So for the women in our audience to join that free women's health community, we've put the link in the chat box. Be sure to check out dropbio.com to get your name on the wait list for the next release of Wellbeing by Drop. But for now, I'm so excited to hear from tonight's speaker. Over to you, Dr. Olivia Ong.
Okay. So I'll be sharing some slides right now. Okay. Okay. So hi everyone. Today I'll be talking about managing chronic pain, a holistic approach. In the next 45 minutes, you will all learn how pain works in the body, why chronic pain persists, how mindfulness and self-compassion, which changed my life, can certainly change your living experience of pain, and certainly mindfulness and self-compassion have changed my patients' lives as well. And I'll be finishing up with Q&A with the community and the pre-prepared questions by the by the community that has been submitted over the past week or so. In regards to pain, it's multifactorial. And from a physiological level, when the pain signals happens in the body, there'll usually be pain signals coded and interpreted, and then it will travel through the nerves and then into the spinal cord and then to the brain, where it gets perceived by the brain, and this is what we call somatic description. And then the brain will interpret that, hey, there's a threat there, you've just burned yourself or you've just injured yourself, and then it'll activate the muscles to just help you avoid that threat. And then when pain happens, the autonomic nervous system and the immune system can be activated as well. And the thing is, pain is such a multifactorial experience, because there's also emotions at play. There'll be anxiety, anger, and fear. And one's pain experience can certainly be modulated by gender. Like females tend to experience more pain than males. Age, the elderly experience more pain. And psychological factors, people with previous history of depression, anxiety, PTSD certainly will experience their pain very differently from those who don't have those conditions. Social factors, such as lower socioeconomic status, that can certainly affect one's pain experience. Genetic factors, things like migraines, headaches, fibromyalgia can certainly be genetic. It can be can be passed down from mom to daughter, father to son. And in individuals who have had a prior history of trauma, will have what we call a hyperarousal response when they have a pain experience. And certainly in this diagram, which beautifully illustrates the pain experience in a normal setting, when there is a signal that there is pain, and the small fibers A delta and C fibers are the large fibers, they transmit signals into the spinal cord, where it gets processed and modulated by the spinal cord. It sends a signal, which is the green arrow, up to the brain, and the brain suddenly interprets it as a pain experience. And this can be affected by several factors. It can be affected by mood, such as depression, catastrophizing, and anxiety. And there'll be other factors such as chemical and structural factors, neurodegeneration in people with Alzheimer's dementia. Suddenly, they can experience pain quite differently from those who don't have those conditions. Parkinson's disease, suddenly I've looked after people with Parkinson's disease, strokes, and they experience pain a lot differently than other individuals who don't have those neurological conditions. And suddenly there's a metabolic component to it. There's neurotransmitters which transmit opioid-like neurotransmitters, dopamine-like neurotransmitters that can affect the way we experience pain. And in individuals who've experienced pain for a long time, sometimes what can happen is that we call it maladaptive plasticity, where the brain has reshaped itself. Like, for example, if you've had an injury to your arm and you've developed long-term arm pain, you obviously stop using the arm and try to compensate with the other arm, and the brain also adapts not in a good way, because not only will you be overcompensating with the good arm, which leads to more problems in the area, you're not using the affected arm, which then the brain kind of forgets that the arm is there. That's what can happen, really. And the other thing, how pain experience can be modulated, will be the context, because all of us come with different pain beliefs, different paradigms, and that can certainly affect the way we perceive pain, expectations, and certainly expectation of a cure, and will certainly affect your pain experience if that doesn't happen. And placebo as well can certainly affect one's pain experience. And I also want to talk about cognitive set, which is the way behavior is manifested, such as hypervigilance when one experiences pain, reduced attention, getting quite distracted easily, and catastrophizing, where they start having ruminating thoughts. And this is a really interesting slide. So the British Medical Journal actually published a report about this picture where this nail went through this builder's boots, what happened was that the builder fell off a really probably about 7 foot height, and he landed on a long nail like that, and it perceived as if it pierced through the shoe. And this particular builder was screaming and yelling, and he was in a lot of, I guess, in a lot of pain. And he was presented to the emergency department, had lots of intravenous morphine. But interestingly, when the emergency physicians opened up or cut open the shoe, the needle or the nail was lodged in between his toes, not through his toes or through his foot. I thought that was really interesting. And that kind of shows that this pain can certainly be taken in context, even though the pathology may not be, I guess, as serious as one thought, but it can be taken in a different context by the individual. And this builder was certainly not drug seeking. He generally thought he had a nail injury to his foot, and that's why he was screaming and yelling in pain. And similarly with the nail through the eye socket, very similar story. It actually didn't hurt and this is quite interesting. It's the opposite of this gentleman, where this nail went through this individual's head, but he didn't even report any pain at all. So it's quite interesting how pain can be taken out of context sometimes. And Henry Bircher is a physician who did some studies in the war area and post-war area on patients with pain. So Henry was working as a doctor, a medic doctor, with war veterans in World War II, when he noticed that when the war veterans came to the war or combat hospital for presenting for treatment, they weren't needing much intravenous morphine. In fact, they've got wounds, but and not needing much intravenous morphine, which I thought it was really interesting. And when Henry put in the intravenous drip, they did report there was pain when that happened. So this is, again, like pain taken in a different context. And then Henry went on to return back to his work in post-war New York State. He went back to work and treating trauma patients with gunshot wounds and things like that, who had very similar injuries to the war veterans he saw in World War II, but they were needing quite higher doses of intravenous morphine. And also, more of them were needing intravenous morphine as well. So it's quite interesting how these two groups of people have very different contexts with regards to their pain experience. Like the war veterans, to them, I guess, with the wounds, it means that they actually survived the battlefield and they're able to go home to their families. Whereas the individuals, the trauma patients who've had gunshot wounds, certainly they were probably thinking about, I won't be able to work anymore and support my family, and thinking about the worst case scenario about what if they can never ever return to work. So their pain experience is also a lot worse in that regard. And certainly chronic pain becomes a problem when it starts to spill over in a biopsychosocial way. This is a term that we use a lot in chronic pain management. We use the word biopsychosocial model. And what do I mean by that? When chronic pain happens, it causes problems in the biological realm, the psychological realm, as well as the social realm, and we can safely say the physical realm as well. When one has chronic pain, what tends to happen is that individuals will start using analgesia or analgesics, like pain medications, for a long period of time, which potentially can be very harmful to their bodies. And add on, they take sedative drugs because they are not able to sleep very well. And with using these medications and sedative drugs, you can have side effects such as stomach problems, lethargy, constipation. And what can happen with chronic pain is that they go through a merry-go-round of getting treatment after treatment, and unfortunately some treatments keep failing, and they're wondering, why is this all happening? And that leads to feelings of depression, helplessness, irritability, and poor sleep. And certainly when one develops chronic pain, you start to develop unhelpful belief systems and thoughts about yourself and your pain experience. And that can worsen the problem of depression, emotional health, becoming quite poor, feelings of helplessness, irritability, and poor sleep. And because when one has chronic pain, you're not moving around as much, so you become physically less active. And as a consequence of that, you start to develop physical deterioration, which means that your muscles become, we call it atrophy or wasted. That means because they're not active anymore or not being used as much, and then the joints get stiff as well. And because of chronic pain, sometimes what can happen socially, the individuals won't be able to return to their job, or they might have to retrain themselves, and they will land themselves in situations where they're in a financial difficulty situations, and there'll be family stress as well, because when an individual experiences pain, it's the family members won't, because it's a silent suffering. The family members will, I guess, won't be able to will feel quite helpless as well, watching the individual suffer from chronic pain, and that can result in relationship issues. And I want to talk a bit about most recent trends and approaches, which have gotten a lot of results in more recently in we call it multidisciplinary pain management programs, which involves physiotherapy, psychology, and medical. We have introduced approaches like mindfulness and self-compassion therapy as well. So I want to touch on about mindfulness first, and then I'll talk a bit about self-compassion and how these two approaches can really help with the way you experience your pain and can help you lead such much more fulfilled and balanced and inspired lives despite the pain. So mindfulness, it is described by Jon Kabat-Zinn in 1994 as paying attention in a particular way on purpose in the present moment and non-judgmentally. Traditionally, it's been viewed as a skill that's cultivated from meditation practice from Buddhism. It's a practice of non-doing and non-striving. It's not goal-oriented as such. But Jon Kabat-Zinn beautifully said, the best way to achieve your goals is to back off from striving for results and start focusing carefully on seeing and accepting things just as they are, moment by moment. How beautiful is that? Just seeing, accepting things just as they are, moment by moment. And certainly that's the case with pain. If you start to accept pain, you start to control your own situation surrounding your pain and not letting pain control you. This is what it is with mindfulness. And mindfulness certainly is being adopted a lot in healthcare settings. We refer it research refers it as mindfulness and acceptance-based approaches. And Jon Kabat-Zinn interestingly set up his program, which is called Mindfulness-Based Stress Reduction, MBSR, at the stress reduction clinic where he worked. He actually enrolled patients with chronic pain into his program, his pilot program called MBSR, and he noticed that the patients with chronic pain were starting to show improvements in their ability to cope with stress, pain, and illness, and he found that really fascinating. So he started enrolling other people as well, other different demographics, different psychographics, and he's starting to notice very similar results as well. So this particular program is an 8-week program using mindfulness as a way of coping with stress, pain, and illness. Involves 2.5 hours weekly class and 1 full day of session or retreat, and incorporates mindfulness practice such as body scan, sitting meditation, hatha yoga postures, mindfulness in everyday practices, activities, and discussion on stress coping, and involves the participants doing at least 45 minutes of formal mindfulness practice 6 of the 7 days of the week. And the second approach I want to talk to you about is mindfulness-based cognitive therapy, MBCT, which was founded by Siegel and his team in 1995. It is an 8-week manualized group intervention based on MBSR. And this is specifically more for recurrent depression. And the major difference from MBCT to MBSR is that this particular program, MBCT, has a strong emphasis on developing a detached view of one's thoughts. And the third approach is ACT, or acceptance commitment therapy, which is one of the gold standard approaches that we use nowadays, certainly in multidisciplinary pain management clinics, not just in Australia and New Zealand, around the world as well. And this involves mindfulness and values-based approach, and certainly involves self-compassion as well. There's no specific time commitment regarding mindfulness practice with regards to ACT. And the next approach I want to talk to you about is DBT, which is dialectical behavior therapy, and it's developed specifically for treatment of borderline personality disorder. Again, there's no specific time commitment regarding mindfulness therapy or a practice, and it's a year-long program overall. It includes individual and group interventions. And what's the evidence so far with MBSR, which is the one that John Kabat-Zinn did and found that the patients with chronic pain has good results in terms of coping levels as well as stress levels. And another study done by Beer in 2003 showed that overall there were statistically significant improvements in pain ratings, other medical symptoms, and general psychological symptoms. And the gains were eventually maintained. That means that these people who reported improvements in their pain scores and their symptoms and stress levels, anxiety levels, and depression levels maintained the gains even at follow-up up to 4 years. Although the number of people being followed up gets smaller and smaller, but that happens generally at follow-ups anyway. And certainly there have been pilot studies which they've done randomized controlled trials with chronic lower back pain in older adults, which showed improvements in quality of life scores such as chronic pain acceptance questionnaire and SF-36. And there's been no but for this particular pilot study, there have been no change in pain ratings. And there's also been recent studies, and one of them and many other studies. I've just chosen this particular one by Rosenwig et al. In 2009. Overall, they found significant improvements on quality of life, but interestingly, those participants with 2 or more comorbid pain conditions, so they could have fibromyalgia or back pain, fibromyalgia headaches, and like combination of different pain conditions, 2 or more, essentially will experience largest improvement in pain severity and functional limitations compared to just developing, just single pain conditions like arthritis, headache, and migraines. And certainly participants who adopt greater home meditation will see that they develop improvements in overall psychological practice, doing 20 minutes, 6 days a week, and also symptoms of how they perceive their pain, their own self-related health, and average practice. This is the participants who have been doing greater home meditation practice, 20 minutes, 6 days a week. And MBSR has also improved symptoms in anxiety and panic disorders. But the problem with a lot of research in pain management in general is that it is hard to apply no intervention or no approach in the control group, because usually we will need an intervention of some sort. And we talk about inconsistent measures and outcomes because everyone's pain experience is so different. Like, someone could have a similar level of injury. Let's say someone can have a similar, like carpal tunnel syndrome injury, and they could experience pain very differently. And most of these studies were done actually by the developers of the program themselves. So there's been some problems here and there with the study results. And now I want to talk a little bit about, let's take another journey towards self-compassion, which is more about how you can be your own best friend. And that's certainly how I tell my patients what self-compassion is how to be your own best friend, how to treat yourself like how you treat your mates, and I will talk a little bit about how self-compassion can be so helpful in helping you dealing with a chronic pain experience. And as we all know, chronic pain can certainly take a huge toll on your mental health. And certainly I've had lots of patients and clients who've had this happen to them, and more often than not, I see chronic pain, depression, anxiety. And what can happen with chronic pain is that there is a lot of really difficult emotions and feelings that comes with the pain experience. You can develop anger, frustration, blaming yourself for the pain, and just being your own worst enemy towards yourself. Not only towards yourself, and also towards other people as well. You're projecting all these difficult emotions towards other people. And this is quite common scenario that I see in my patients. And sometimes it's really difficult to manage from day to day. And practicing self compassion, what it means, it's taking a kind, accepting, and non judgmental stance towards oneself in times of failure and difficulty. And this only can make living with pain and responding to its challenges a lot easier. And what is self kindness? This is the first component of self compassion. And the opposite, of course, is self judgment, where you keep criticizing yourself harshly all the time. Especially, I see this in my patients with chronic pain. They tend to blame themselves for their pain, and they have a lot of negative inner dialogue. But what self kindness involves is being kind, caring, and taking a non-evaluative stance towards perceived inadequacies, shortcomings, and mistakes, because we're all humans, right? And this may be particularly valuable for countering that negative self-evaluation that can happen with chronic pain. The negative self-evaluation can certainly accompany not being able to meet your own expectations of living with a chronic condition, and how quality of life has been restricted, and you're not able to do the things that you enjoy anymore, the hobbies that you used to do. You can't hang out with your kids anymore, in a way that you can't run after them, pick them up as easy as you would prior to your pain experience. And certainly self-kindness is a way of just trying to accept things, pain just as they are, and learn to let it not control your life, and let you be the master of your pain experience and control it. And that's certainly in our pain management programs, multidisciplinary pain management programs, we encourage mindset mastery and just self-compassion, mindfulness, just to give that power and control back to our patients. Because I have to say, a lot of my patients with chronic pain don't have any control, no power over their lives. So when they finish up the programs with us, they report improved scores in stress, anxiety, depression, even perceived levels of self-esteem, confidence, and how they manage their condition. All the scores have improved. And common humanity is the second component of self-compassion. It means that you're not alone, because sometimes with pain experience, more often than not, you just feel that you're the only one experiencing the pain, and no one gets you, no one understands you. But common humanity is that sense of connection to others that arises from acknowledging the common human experience of imperfection and making mistakes, and being aware that others may face similar challenging circumstances. And this frames hardship from this perspective can help people let go of the why me view of their illness, which can compromise adjustment to their chronic pain experience, and foster a greater connection with others who live with very similar conditions. And certainly I see this in my patients when they start doing the program, because our pain management programs are group programs, so they get to connect with other chronic pain sufferers, and they form a community and alliance, and they're going on a journey together to educate and empower themselves about pain science, pain management strategies and tools from a biological, medical, which is essentially the same thing, psychological and physical perspective, to help manage their condition a lot better. And that's certainly what I do a lot of education sessions for GPs as well, to teach them about the biopsychosocial model of looking after patients with chronic pain, and things like that. So I think educating the patients themselves, and educating the primary providers or primary care physicians who are looking after them as well, is also very key, because we all need to collaborate together to work together to help our patients move forward and lead more fulfilling lives, actively manage their pain. That's why we need to collaborate together and communicate that. And lastly, mindfulness is one of the very important components of self-compassion versus over-identification of emotions. That's when you identify with difficult emotions, like you start to feel angry and you let it take over your body. Mindfulness is the exact opposite, where you take a more balanced and non-judgmental view of emotional experiences, grounding them in the present moment, and neither ignoring nor becoming overly embroiled in the negative feelings that accompany the painful experiences. This mindful stance is particularly very beneficial for dealing with the ongoing pain and suffering of living with a chronic health condition, and encourage healthier ways for the individuals to view their limitations associated with chronic illness. And a recent study published in the European Journal of Pain evaluates the association of self-compassion with several domains of functioning in people experiencing chronic pain. Results show that self-compassion was positively associated with pain acceptance, use of traditional and flexible pain coping strategies, and success in value-based activities. The results show that self-compassion is negatively associated with physical and psychosocial disability, pain anxiety, and depression severity. In other words, pain acceptance, depression severity were the variables that are most influenced by self-compassion, which accounted in both cases for approximately 30% of the observed data variance. And this study just clearly shows and reflects and expands on previous research that's been done on self-compassion in individuals living with chronic pain. It shows that self-compassionate people with chronic pain show higher acceptance of their pain, greater psychological well-being. They tend to see themselves and others in more positive ways, and they're less burdened by stress and adjust better to physical limitations. Likewise, the few studies that directly address chronic pain suggested that self-compassion is correlated with higher levels of emotional resilience and positive mood, positive affect, and lower levels of depression, pain catastrophizing, as in ruminating negative thoughts about their pain, and pain-related disability. And as I've alluded to earlier, self-compassion is a key treatment mechanism in mindfulness-based therapies such as ACT, acceptance and commitment therapy, as well as mindfulness-based stress reduction, or MBSR. So in line with the intended goals of these approaches, the study stresses out that in the context of chronic pain, self-compassion does not aim to reduce the primary suffering, as in the physical pain, but rather attempts to reduce secondary suffering like the ineffective responses to pain. As research continues to support and validate the long-standing view that self-compassion makes pain more bearable, I believe in this truly. This is the main vision why I do what I do in pain medicine. I want to instill self-compassion in my clients and my patients, in what I've learned, how self-compassion transformed my life, and how self-compassion can certainly transform the lives of my patients. It's certainly a desirable goal, not only in physical therapy, but pain management programs out there around the world. I just want to know, what is your biggest, takings, learnings, aha moments so far? And feel free to type it in the chat, and we will go through some questions right now.
Wow, thank you so much, Olivia. That was a fascinating talk with some really interesting food for thought there, and I think a lot of hope as well. I think we were speaking earlier, and you mentioned up to 20% of the population experience chronic pain. So hopefully people are feeling a little bit more hopeful and a bit less alone in that, in talking about some of the different techniques and research and programs that you guys run that sound incredibly transformational as well. So it was absolutely wonderful to hear you speak. I'm sure there's lots of questions in the audience. We've already got a few that have come through, so I might jump in and start asking those of you,
Yes.
and then I'll jump to some from the Drop-In Women's Health community that have come through early this week. If you've got a
Sure.
question, just drop it in the chat box, guys, and I will we'll aim to get to it in the next 20 minutes or so. So we'll start just in order as they came through. A couple of questions from Julia, who said that she's actually a Pilates instructor and physiotherapist who's personally experienced the positive influence of mindfulness and self-compassion. She said it's really changed her life and still is. She says, I find some people find it, and I think she means self-compassion, a bit woo-woo. I'm wondering, what do you find helpful in order to get people interested in mindfulness and self-compassion, both people experiencing chronic pain and those supporting them, including healthcare practitioners?
This is a really good question from Julia, and certainly I work with a team, And I work with in a multidisciplinary pain management team, which involves several excellent psychologists who are trained in mindfulness and self-compassion therapy, and also physiotherapists who also work very closely with in the program. They do a bit of cognitive behavioral therapy. They learn also mindfulness techniques. So we all work together, and I think as long as we all kind of talk about the same thing and share our message across to our patients, I think consistency is key. And I think repetition is the mother of all learning, because we all just talk about the same thing. The physios talk about the same thing. Mindfulness, it can help with chronic pain. I talk about it, and then the psychologists talk about it. It just reinforces that. I think that gets the woo-woo out of the mindfulness and self-compassion, because the clients themselves can see the transformation in their lives, and people have done the program coming back to speak to them about it and how it's changed their lives. So I think that's been quite helpful, and really just gets the woo-woo out of it, and makes our patients more, I guess, more receptive, more accepting of it.
And I guess some of that really interesting research, I mean, there's quite a bit of research there that
Yes.
you've shared with us tonight that sort of looks at the impact that it's had, and some really promising insights there as well. Just going back to sort of the definition of chronic pain, does someone, Amit has asked whether or not that applies to pain after surgery?
Yeah, pain after surgery is really is interesting. So this Amit's probably a healthcare professional, and
May well be.
or could be an individual who's suffering from it. So pain after surgery, I've seen this quite commonly. So I'll probably just break it down to the definitions of like what is acute pain and chronic pain. I should have just
That would
done
be
that
great.
earlier.
Yeah.
So acute pain is when you experience pain and it's less than 3 months. So we're talking about people who have just had surgery. It can be appendectomy, like they had the appendix out. That's acute pain. Or back surgery. That's acute pain again. And in between 3 to 6 months is what we call subacute pain. Usually by the 3-month mark, we will expect acute pain to kind of resolve. And people who've had surgeries and things like that will have noticed that in the 3-month mark, they will have actually not be on their pain medications anymore, and they start to kind of transition to sort of normal lives. Whereas if they still have pain 3 to 6 months, it means subacute pain. That means there is a chance that it might evolve to a chronic pain picture, or it might just just resolve. It's probably the acute pain experience just taking a lot longer than usual. And chronic pain is when pain occurs more than 6 months or more, up to years, months and years. So that's chronic pain. And chronic pain, what it means is that it's when individuals develop prolonged pain. And because they've developed prolonged pain for a long period of time, their nervous system gets sensitized. We're talking about the central nervous system in this regard. We're talking about the spinal cord, and the brain gets hypersensitive. We call it hyperalgesia in the pain medicine world. So the pain experience is a lot amplified. And when I had the diagram of the pain signals going up to the brain, when someone has chronic pain, the input or the signals coming in is more amplified. And of course, when it goes to the spinal cord, it's amplified again. It goes to the brain, it amplifies again. And usually the brain will send signals to dampen the pain signals down. But in this case, in someone with chronic pain, that signal to dampen it down is reduced. That's why we talk about the bottom-up approach and the top-down. Top-down meaning psychology, because the ability for the brain to reduce the pain signals is less. That's why we do a lot of psychological approaches like acceptance commitment therapy, cognitive behavioral therapy, that helps to help the brain to produce more brain pain signals to reduce the pain experience. And certainly with physiotherapy and other techniques, physical techniques that can help with the bottom up approach, which is like activating the muscles again, which have not been activated for a long time, and getting the joints moving again. That's all we call it bottom up approaches. And certainly medications, it's also bottom up approaches. And I have to say that medication is a very small part of what we do as pain physicians. We help to encourage our patients to actively lead lives without relying too much on pain medications, and utilize physical strategies from the physios and psychological strategies from the psychologists just to help them lead more active lives, even despite chronic pain. And interestingly, pain after surgery can happen, especially in someone who's had chronic pain, people with chronic pain going through surgeries for acute pain, like, if they've developed appendicitis in someone with fibromyalgia or things like that, they can certainly have a not so good pain experience after the surgery. So I think that's really important for people who are looking after, I guess, individuals with chronic pain, to be aware that all these things are happening before surgery, and to get the pain specialist or involved really early on. And we can certainly help to facilitate that, and prevent a negative pain experience after surgery. So I get involved with, let's say if my patient is going for surgery and I've been looking after them for a couple of years, I usually speak to the anesthetist and give them a plan about how they've been managing their chronic pain so far. And yeah, just that I think communication and collaboration is so important. Yeah.
Yeah, it makes a lot of sense. And I guess
Mm.
being prepared for pain as well, because I
Yeah,
imagine that,
exactly.
the shock of it and sort of being kind of having that suddenly come into your life
Mm.
can be very overwhelming as
Mm.
well. So many great questions coming through.
Yeah.
I thought this might come up in terms of seeing the multidisciplinary pain management team where you are. Is it a referral process? How do people get into those programs?
Yeah, I work in the public hospital setting and as well as private setting. It's quite different. In the private setting, I look after mainly injured workers after a workplace injury. In Victoria, we call it workers work cover. So I look after injured workers. I also look after a individuals who've been involved in motor car accidents, motorbike accidents. So they're covered under Transport Accident Commission here in Victoria. So that's in the private practice. We call them compensable clients, which means they're being, I guess, they have case management by either the TAC or work cover managing their cases. And in the public setting is where I look after patients, I guess, not injured at work or non-injured at car accidents. They have pain conditions like fibromyalgia. They could have arthritis conditions like you know rheumatoid arthritis, seronegative arthritis, lots of different other like SLE, and lots of different um, other pain conditions like headaches and migraines. We see a lot of that. We see a lot of hypermobility syndromes, pelvic pain, back pain that's not not work related or not accident related as well, which can happen when people are assaulted and things like that. These things do happen, and we look after them in the public hospital. But I think regardless of the demographics and psychographics of the patients, the approach is very similar. It's multidisciplinary pain management programs. We have psychologists. We usually have physiotherapists, and I think in the public hospital, well, we also have dietitians and occupational therapists. So we have more staff members actually. And yes, the answer to that is that it's referral process. But as all of you are aware, in the public hospital system, it's a long wait list. That's about 6 to 12 months wait list, whereas in the private practice system, which is work cover TAC, is a lot quicker because it's lesser number of clients going through and patients. Yeah.
Okay, thank you. Had a question from someone in our drop-in women's health community who asked, what role can an employer take to incorporate chronic pain sufferers back into the workforce?
Mm. And certainly, I look after a lot of injured workers who've had a workplace injury, and they've come to us probably quite distressed because a lot of them have been really working for a long time in their industries, and unfortunately, workplace injuries do happen. And of course, a lot of them have got families and they have bills to pay, mortgages, and yeah, of course, that's always weighing at the top of their mind. And certainly employers, I think this is where I think compassionate leadership in employees, it's really important. And I think this is where the employers need to really be a bit more empathetic and compassionate towards the clients. And I find that my patients who have had really supportive and positive employers who are really quite compassionate towards them, they actually they transition back to work. Although they start out in light duties or things like that, they eventually get back to their full-time capacity, and they're happy again. That's because their employees have shown a lot of support and given them, that kind of not just emotional support, just physical, like social support and physical support, mental support, and just cheering them on from the sides. And I think this is, and then I'll encourage employers out there to be like a lot more compassionate towards these workers, because it's going to take time for them to, because in the whole program itself, a pain management program is about 3 months in total. And then we have post-program therapy sessions as well to help them. We call it graded return to work program, where, because it's like running a marathon for these clients again, they have to retrain their muscles, retrain their brain as well, because they haven't been working for a while. And eventually they will get there with the support of my team and or the teams that I work in. Eventually they will get back to what they used to do, or even if they retrain, they'll get to a job and get back to the life that they're meant to live, basically.
Yeah, wonderful. We've had some questions in regards to pain and different age groups, so I might try to consolidate a little bit.
Yeah.
Are the symptoms the same for all ages when it comes to pain? And can children have chronic pain?
Oh yeah. And suddenly, so I'll answer the first question. And
Yeah.
it's quite extreme. The kids and the older adults, like people in their 70s, 80s, experience pain the most. And I'll explain why the older adults experience pain the most is because over time, our liver, our nervous system, our musculoskeletal system age with time, and that's quite normal. And the way the bodies metabolize the medications are not as good anymore, and certainly their exercise tolerance level is different. So that's why the older adults experience pain a lot worse, and the younger patients, like the kids, they will have a very different pain experience, because you have to think about, when kids get pain, their parents are also involved in the equation too. And the Royal Children's Hospital in Melbourne we've got a pediatric pain clinic. And certainly in Monash Health, where I work, there's also a pediatric pain clinic. And because we acknowledge that some pain conditions can exist even from childhood, adolescent years. We're talking about juvenile arthritis that exists since birth, and some kids may have pain conditions since they were born, like cerebral palsy and things like that. So of course we've got programs like pain management programs in pediatrics to help not only the children lead more active lives despite their pain. The parents educate the parents as well, and kids probably experience it a lot worse because they can't, not like adults, they can't say, I've got pain in my my shoulder, it's burning, and it's piercing and all these things. So the descriptors of pain are very different. More often than not, I think what I recall when I was coming across some pediatric pain patients, interestingly, the occupational therapists and there's art therapists, they encourage these kids to actually draw out their pain experience, which is quite interesting. I think they use a lot of other modalities like art therapy, music therapy, even pet therapy as well. And I think the Royal Children's really is the gold standard for this, for sure.
Well, that's amazing. And just on that, what can parents do to help their children in managing their pain?
Yeah. I think with pain, suddenly, because the kids are trying to manage their pain in their own possible way with whatever resources they have. I think as parents, we obviously have a tendency to, I can say that because I've got 2 kids, we have a tendency to overprotect them and then get them, just overprotect them way too much because they have the pain condition. I think my encouragement to parents who've got kids with chronic pain is to give them some autonomy as well, because I think that's what they want to, because they are, they want to lead sort of normal lives. And I think that will be my encouragement. Protecting them, but yet also giving them some autonomy will be a good balance, I feel.
That sounds like good parenting advice all around, doesn't it?
Yeah, exactly.
Getting that balance right.
Yes.
We've only got a time for a couple more questions, but there's 2 more that our community sent through that I really wanted to ask.
Sure.
The first one is, what role do exercise and strength training play in chronic pain management?
Okay, huge. This is a really good question. A huge part of our pain management programs, that's why we have a physiotherapist, not just one, several, in fact. And the physiotherapists that I work with are trained in cognitive behavioral therapy and ACT. So the things that psychologists learn, they learn themselves, because they need to kind of, they have to shift and reframe lots of negative beliefs. Even during exercise, this comes up a lot. What we often see, which is quite common, is not being able to pace themselves. And we understand that a lot of our patients and clients have got families, have got busy lives. And on a good day where they don't have pain, guess what they do? They clean the house, they vacuum, and they garden, and they do lots of things. And the next couple of days, they lie in bed and they suffer in agony. So that's why we always start the physiotherapy sessions by talking about pacing. And I also reinforce that in my patients. Like, pacing is really important. Just vacuum a little part of the room each day. And then it may seem really, very, very small task, but it's like running a marathon. You can't just like rush to run the marathon straight away. You got to build yourself up. So we certainly encourage them to pace themselves, also to keep a pain diary. And the physios obviously will start at a really baseline level for everyone, because we have to start low, go slow type of thing. So yeah, the physios are very good at increasing progressions of the exercises. Very vital role in our pain management programs.
I'm sure it's very tempting when you have a burst of energy and you've been experiencing fatigue and chronic pain to want to make up for lost time.
Exactly.
It sounds like a real sort of practice to have to learn how to put in place. Okay, we've got one more question for you. So many wonderful questions that have come through. And look, if we haven't gotten to yours tonight, then please know that we will endeavour to get it answered over the next couple of weeks with Dr. Olivia in our women's health community and on the drop-in website. But I thought a great one to finish on was, is there any hope of a complete recovery from chronic pain, or any final words on living with chronic pain, Olivia?
I guess that's a really good question, because I guess a lot of people with chronic pain, obviously anyone with pain, having any pain of any sort, will hopefully want a resolution of that pain experience. But just think about it as asthma and diabetes. Like, eventually people with asthma and diabetes learn to live with their condition and still lead active lives. Some of them are even athletes. And just think about chronic pain in the same way, not as a torture or burden. It's an illness and condition that you will be able to actively learn and manage. And I guess that to me is recovery in my words, because not only you've taken control of your life and you've not let pain do that anymore over your life, you actually have taken full control of your life and not let the pain monster get in your way. So you're full mastery over your life, you're leading happy lives again, and despite the pain. So this is what a lot of my patients actually report when they eventually finish the program. They're still able to do the things they do, but in a different way, a new normal.
Yeah, that's wonderful to hear. And you are obviously the living embodiment of that as well, with everything that you've been able to achieve. I know you've got a new book out as well around the heart-centeredness of medicine, and we've put a link to that in our chat box for anyone that wants to check that out. And I think we'll try to get a copy of that to give away in the drop-in community in some time over the next few weeks as well. So keep your eyes peeled for that. But we are pretty much at time. So I wanted to thank you so much, Olivia, for your generosity and wisdom, and the hope that you've hopefully given a few people around ways to frame chronic pain and the way that they may be living with it. I'd also like to offer a really big thanks to all of our attendees for your time and questions. Keep an eye out for our email tomorrow that will have the event replay coming out. And we also have a short survey about this event linked at the bottom of the screen. If you have a moment to fill it out, it's just a couple of questions. We would really appreciate it to make sure we can continue to improve our events for you. As mentioned, we've put Olivia's social handle in the chat box so you can follow her work along with a link to that new book. And as promised, we've also put the link in the group chat box to check out Drop Bio and the Drop In Women's Health Facebook group, where we will keep the conversation about managing chronic pain going. But that's it for tonight. Thank you so much again for your time, Olivia. It was wonderful to have you. And we hope you'll come back and hang out with us again in the drop-in really soon.
All right. Thanks for having me, Abby. And thanks everyone for coming to the session today.